All right, so these are questions on cystosomes, and the first one is saying which of the following species of cystosoma commonly causes urogenital cystosomiasis? So remember, urogenital is hematobium. The other ones normally cause intestine. What is the intermediate host in the cycle of cystosomiasis? Intermediate host is a snail, and it depends with which type of cystosoma you are talking about. It will determine the genus of the snail. Sicaria are the infective larva form of cystosomiasis that are released by. Now remember the sicaria, what will happen is that the miracidia is going to enter the snail. In the snail, miracidia will develop into the sporocyst and then into sicaria. The sicaria is now going to be removed by the snail, freshwater snail. Which of the following statement is true regarding cystosomiasis and its impact on the host? Infection is primarily asymptomatic. Really not true. Okay, unless in the first stage, the adult worm are the main cause of disease. It's actually the eggs which are the problem. Eggs trapped in tissue induce an immune response leading to organ damage, and that's a problem. Natural immunity to reinfection is strong. Natural immunity to reinfection is strong. Really not. Natural immunity will barely help you. If there is a reinfection, you still get the disease as though you didn't get it before. Okay. The most commonly used medication for the treatment of cystosomiasis is, cystosomiasis. Treatment is basically it's praziquantel. All right. Schistosoma mansoni is associated with which major complication in chronic cystosomiasis? Squamous cell carcinoma, portal hypertension, neurocysticercosis, liver cirrhosis secondary to primary biliary cholangitis. So in chronic, remember this is chronic, not acute, chronic. Chronic disease is portal hypertension, and this can result into different diseases like heart failure can result also. Which diagnostic technique is a standard for detecting stoma hematobium eggs in urine? So for the eggs in urine, you use the filtration technique. Okay, filtration technique. Like you're trying to filter the eggs. In acute cystosomiasis, also known as Katayama fever, what is the common symptom? So you see that is different. Chronic cystosomiasis, the biggest complication there is portal hypertension, but in acute, something that is acute, that's Katayama's fever. And the problem here, the common symptoms you are going to see is these hives. This is basically a response, like you have anaphylaxis. Okay. The gynecophoric canal is a unique feature of which sex of cystosome? Remember, the gynecophoric uh, canal is for the male. That's where the female is normally found. And remember, these guys are actually in permanent copula. They are permanently attached. What is the primary cause of pathology in cystosomiasis? So the what causes disease is the way the body is going to respond to the eggs in tissue. What is the common name for acute cystosomiasis, particularly seen in Schistosoma japonicum infection in naive individuals? That's Katayama fever. Remember, acute cystosomiasis. And it's mostly with japonicum, followed by Mansoni, and less with hematobium, isn't it? Cystosome eggs are trapped in body tissue, causing immune reaction and progressive damage to organs. Which organ is commonly affected in chronic splenic cystosomiasis? Even the word says hepatosplenic, so it's the liver and the spleen. Which stage of cystosoma parasite is released by the snail and infects humans? Again, this is the Sicaria. What enters the snail is the miracidium. After penetrating the human skin, the Sicaria shed their tails and become which stage? So once they enter the body, they'll become the cystosomula, isn't it? Where do adult cystosoma when primarily reside? So these guys result in the venous plexuses, that's the blood vessels. Which species of cystosoma infect the venues of the urinary blood? Remember, it's the one that causes urinary disease, hematobium. What is the role of the snail in the cystosoma life cycle? Because the snail is an intermediate host that is where asexual reproduction happens, and then the definitive host is for sexual reproduction. Cystosoma mansoni and japonica infect the mesenteric vessel, with Cystosoma mansoni infecting the dash mesenteric vessel and Cystosoma japonicum infecting the dash. So the Manson is inferior, the Japonica is the superior mesenteric vessel. Which of the following is true regarding the lifespan of adult schistosoma worms in human? So remember the cystosomes, we said that some of them they can go up to 20 to 30 years. So these guys can live for decades. Okay, they live for long. How are Schistosoma hematobium eggs primarily excreted from the human host? Because hematobium is normally via urine. For the others, via feces. But even the hematobium is also can be removed from feces, but it's rare. What is the term for the free living larva stage that hatches from the egg and infects a snail? So that is the miracidium. That's the one which infects a snail. Which of the following is a key feature of the schistosoma life cycle that facilitates human infection? Adult worm living in the GI. Remember what causes really the disease is mostly the eggs, okay? Not the adult worm. Larva form, which is a Secaria penetrating human skin during contact with infection, ingestion of contaminated water, transmission through the skin. So, the key feature of schistosoma life cycle that facilitates human infection. For you to facilitate human infection, you are looking at the worm should first enter the body, okay, and that results into the the rash that you are going to be able, the pruritic rash that you are going to be able to see. Okay, that is the penetration of the human skin by the Secaria. That is what will facilitate the disease happening. Which characteristic is unique to the schistosoma female worm? They are hermaphroditic. This is not true, right? Because we've got different sexes. Hermaphroditic is the same as monoecious, but these guys are dioecious. They possess prominent opercula. Now, these guys don't really have an opercula, isn't it? They reside in a gynecophoric canal within the male, and we said that is true, isn't it? Their primary cause of blood loss in the host, really not. Which of these statements is true regarding vaccination of schistosomiasis? A conventionally available vaccine is widely used for prevention. Vaccine development is ongoing with promising candidates in trials. As we said, we didn't talk about vaccine, but they are trying different vaccines to make if they will be able to work out. But currently, no. In the treatment of severe acute schistosomiasis, which is the Katama syndrome, what is sometimes used to ameliorate symptoms before Praziquantel is administered. So also give corticosteroids. Remember what you are trying to prevent is the inflammation. Corticosteroids are anti-inflammatory. Which species of cystosoma is associated with eggs containing a lateral spine? Remember the Mansoni lateral spine. Japonica, you've got a terminal spine. Actually, hematobium. What is the typical duration of schistosoma worm infection in the human body if left untreated? So if you don't treat it, it can be there 2 to 5 years, and then it can be cleared if it doesn't cause you to die. The intermediate host for schistosoma mansoni and schistosoma hematobium is, so intermediate host is the snail. Okay, it's a snail. Remember for mansoni we said it is the biomphallaria, and then for hematobium is the bulinus. Katayama syndrome may be caused by Soma mansoni, Soma hematobium, Soma japonicum. Now we said Katayama syndrome is mostly because of hematobium. Actually, most is because of japonicum, followed by hematobium, and then less with the mansoni. But nearly all of them can cause, but more especially with japonicum. And I had given the order earlier. It was Japonicum, Mansoni, and less with hematobium. Hematobium barely none. Okay, so it is Mansoni and Japonicum, but no, Japonicum is the most. Indicate the correctness of the following statements. Snails of the bulinus gene are the host for hematobium, and that's true, isn't it? Bulinus. Intestinal cystomas is caused by Schistosoma mansoni, and that's true, right? Intestinal. Lateral spine is pathognomic of Schistosoma hematobium mature egg. Now, lateral spine is not hematobium. Direct contact with snail can result in infection with schistosomiasis. No, not a snail, right? Supposed to be the Secaria that's coming from the snail. Snails harbor the sexual stage. No, snails are the intermediate host, so this asexual. Infection in Schistosoma mansoni is characterized by the following clinical and pathological features. Swimmers itch, remember that's true, right? Swimmers itch where the worm is penetrating. Catama syndrome, that's true. Seamer's clay pipe stem, this is liver disease, that's true. Portal hypertension, that's true. Gonadal malfunction. This guy can go into different areas, though cystosoma hematobium is normally the one that will cause these gonadal problems. But these guys can also go to the gonads. Remember, they can spread going to different areas. So all these answers are correct. And that is it for this discussion.